Today, we're tackling a common question. How does caffeine interact with medications? Stick around as we uncover the answers and provide valuable insights for managing your health. Don't forget to subscribe for more informative content. Let's get started. Caffeine, a ubiquitous stimulant found in coffee, tea, energy drinks, and various dietary supplements, has long been celebrated for its ability to enhance alertness and alleviate fatigue. However, its effects extend beyond mere stimulation, as evidenced by its capacity to influence the pharmacokinetics and pharmacodynamics of numerous medications. Calcium channel blockers. Caffeine can enhance the effects of calcium channel blockers, leading to potentially dangerous drops in blood pressure or heart rate. Patients on calcium channel blockers should moderate their caffeine intake to prevent adverse cardiovascular effects. High blood pressure medications. While caffeine itself doesn't directly interact with most blood pressure medications, its ability to raise blood pressure levels is a concern. This increase in blood pressure can potentially counteract the effects of blood pressure medications and pose risks for individuals with hypertension. To manage this, patients are advised to consider limiting their caffeine intake, switching to decaffeinated options, or consulting with healthcare providers for personalized advice can be beneficial in optimizing blood pressure control. Lithium. Caffeine can increase the elimination of lithium from the body, potentially reducing its effectiveness in treating bipolar disorder. Patients taking lithium should be cautious with their caffeine intake to avoid fluctuations in lithium levels and mood stabilization. Stimulant medications. Combining caffeine with stimulant medications like Adderall or phentermine can exacerbate the risk of adverse effects such as restlessness, jitteriness, and cardiac issues. Since both caffeine and stimulant medications stimulate the central nervous system, their combination can lead to overstimulation and heightened side effects. Patients may need to adjust their medication doses or moderate their caffeine intake to minimize these risks and ensure the safe and effective management of their conditions. Bronchodilators. Caffeine can interact with bronchodilator medications used to treat asthma and chronic obstructive pulmonary disease. While caffeine itself has bronchodilator properties, excessive consumption may lead to overstimulation and exacerbation of respiratory symptoms. Pseudoephedrine. Sudafed, a commonly used decongestant, shares stimulant effects with caffeine. When combined, these substances can increase the risk of heart-related side effects, such as palpitations and increased blood pressure. To mitigate these risks, patients may consider avoiding caffeine altogether or spacing out its consumption from Sudafed doses. This precaution can help prevent potential cardiovascular complications and ensure the safe use of decongestant medications. Theophylline. Theophylline, often prescribed for conditions like asthma and chronic obstructive pulmonary disease, shares similar side effects with caffeine due to its stimulant properties. Combining caffeine with theophylline can intensify these effects, potentially leading to symptoms such as restlessness and insomnia. Patients are advised to limit their caffeine intake while taking theophylline to minimize the risk of exacerbating side effects. However, any changes to caffeine consumption should be discussed with a healthcare provider to ensure appropriate management of respiratory conditions. Immunosuppressants. Caffeine can interfere with the metabolism of certain immunosuppressant medications used to prevent organ rejection in transplant recipients. Patients on immunosuppressants should discuss their caffeine intake with their healthcare providers to ensure optimal medication levels and immune function. Antipsychotics. Caffeine has the potential to increase the levels of certain antipsychotic medications in the body, which can heighten the risk of side effects. Since caffeine metabolism can vary among individuals, monitoring caffeine intake is crucial for maintaining medication effectiveness and minimizing adverse reactions. Patients prescribed antipsychotic medications should be mindful of their caffeine consumption. and discuss any concerns or adjustments with their healthcare providers to optimize treatment outcomes. Anxiety and sleep medications. Caffeine's stimulant properties can counteract the effects of sedative medications commonly prescribed for anxiety and sleep disorders. By antagonizing the sedative effects, caffeine may reduce the efficacy of these medications, leading to difficulties in managing symptoms. Patients are advised to minimize their caffeine intake, especially close to bedtime, to avoid interference with the therapeutic effects of anxiety and sleep medications. Consistent communication with healthcare providers is essential for addressing any concerns and optimizing treatment strategies. Oral contraceptive pills. Oral contraceptive pills can prolong the effects of caffeine in the body, potentially disrupting sleep patterns and affecting overall well-being. Adjusting caffeine intake, particularly in the evening hours, may be necessary to mitigate these effects and promote restful sleep. Patients starting or already using oral contraceptives should be mindful of their caffeine consumption and consider modifying their habits accordingly to support optimal sleep hygiene and medication effectiveness. Diabetes medications. Caffeine's influence on blood glucose levels and insulin sensitivity can complicate diabetes management. Individuals with diabetes are advised to monitor their caffeine intake and its effects on blood glucose levels closely. While moderate caffeine consumption may be acceptable for some individuals, excessive intake or consumption of caffeinated beverages with added sugars can lead to fluctuations in blood sugar levels. Healthcare providers can offer guidance on managing caffeine intake to support stable blood glucose control and optimize diabetes management strategies. Anticoagulants. Caffeine can interfere with the effectiveness of anticoagulant medications like warfarin by affecting blood clotting factors. Patients on anticoagulants should monitor their caffeine intake to ensure stable blood coagulation levels. Thyroid hormone medications. Caffeine, particularly from coffee, can interfere with the absorption of thyroid hormone medications, potentially reducing their effectiveness. To minimize this interaction, patients are advised to wait at least 60 minutes between consuming coffee and taking thyroid medication. By spacing out caffeine consumption from thyroid medication doses, patients can ensure optimal absorption and therapeutic efficacy of their thyroid hormone replacement therapy. Tricyclic antidepressants. Caffeine's ability to increase the levels of certain antidepressant medications in the body can heighten the risk of side effects and affect treatment outcomes. Patients prescribed tricyclic antidepressants should aim for consistent caffeine intake to maintain medication efficacy and minimize adverse reactions. Any changes to caffeine consumption should be discussed with healthcare providers to ensure appropriate management of depression and related conditions. In conclusion, understanding the potential interactions between caffeine and various medications is essential for optimizing treatment outcomes and minimizing risks for individuals managing chronic conditions. Patients should be proactive in their caffeine intake habits and consider adjustments as needed to support safe and effective medication management. As we wrap up our discussion on caffeine and medication interactions, remember that knowledge is power when it comes to managing your health. Thanks for tuning in, and take care.